Okay, and as far as counterfeit for N95, as long as it says made in USA, and as long as you're buying from like trusted sources, and as long as you can see that it's a 3M product, I mean, it's really hard not to see that it's a 3M product or Medline or somebody like that.
Right.
I don't think we need to really worry about it. My biggest counterfeit worry is about KN95, which we're going to talk about in a second.
Yes. Yes.
So I don't think we need to spend too much time, as long as you trust the source, or at some point the big brands the big name companies will come back and start selling those. I think the restrictions will get lifted. For the medical, dental, we'll start getting them, and we'll see how it all plays out.
I think it will.
Okay, that's awesome. All right, so now let's talk about the KN95s.
Okay.
I'm trying to wrap my head around this thing. Up until May 7th, we had manufacturers that were on a list of KN95s.
Yes.
Approved manufacturers. Then May 7th comes in, and there's only 2 manufacturers left, like Powwow or something like that, insurance company, which is really interesting name for a mask manufacturer. And then some other things come back. And then somebody refers to CDC Appendix A. Like, that to me is a little bit confusing. Do you know what I'm talking about?
CDC Appendix A is the list of the masks that have been cleared under emergency use authorization. And they also have a list in there that talks about the ones that have been removed from the list, because they may remember these are manufactured primarily in China. Some are from South Korea. And when they come with the certification, it's just like the one that you sent me or had sent to me. Most of that documentation is in Chinese. So how would I know if it's authentic or not? I don't. Okay.
I did a little homework.
All right.
Because, I mean, with our members know, like, we did this group order, right? And I felt a little bit uncomfortable because we did the order and we're putting this all together. We did our due diligence. The company that order came from was on an FDA list. And so then our members reached out and said, so what about now? So I really don't know what to say. Like, I honestly, we're trying to help. Our whole thing was, how do we help our offices? So now let's talk, first of all, let's talk about, what do I want to talk about? This is what we did. Where is it at? So I started asking around. So first, how do we know the counterfeit or not counterfeit? So let's assume that anybody can produce these documents left and right. And I've seen FDA fake approval documents in the last 2 weeks, more than you can imagine.
Yes.
So when we talk about the counterfeit versus not counterfeits on KN95s, the first thing we've learned is the manufacturer from who the product is manufactured should have an FDA certificate on file with their name and approved product, which should look like this. And I'm going to switch the screen so that everybody can see it. Mary, you can't see it yet, right?
No.
Okay. Can you see it now?
Nope. Now I can.
Okay.
Yes.
So that's what we were told. That's the first line of defense. The manufacturer should have this thing.
Yes.
Okay. Then,
although those could be counterfeit as well, but
exactly. Let's just take off the table that anybody can make those documents left and right. But if you, for example, when we talked to the manufacturers and we said, we're doing our due diligence, this is what we're told. The first thing is we need to get this document. The second thing is the manufacturer must be on the approved Chinese exporter list, which is in Chinese and in English. I mean, and it looks a little bit like this. And I've done my best to try to learn what does it say. I can't even say that I have. But what I was able to do actually study some of the test reports. So which we're going to get to in a second. So while that list is opening up, I don't know where is it at. My computer is weird. The most important, there should be a testing report on file that they can send to show you they are a legitimate product. See attached. Now, tested report is this one. So when I looked at the test reports, for me, the most important part was the names match.
Mm-hmm.
So when I, for example, go in, I check applicant, the name matches, the address matches, what's on the FDA certificate. That's the first thing I want to make sure.
Mm-hmm.
Actually, it's funny. And when we did the due diligence, there's actually a good number, like 95% of things that we were doing due diligence on, just this simple thing did not match. Like you can already filter out a lot of this stuff if you just try to put documents together and match the names that they're matching everywhere.
Right.
So if hypothetically they match, then we'll look at the test reports, and there are two types of test reports that I've seen. One is where it says pass.
Mm-hmm.
So for example, medical phase requirements, this is requirement and test methods. So Europe certification, client manufactured test procedures, press deviations, and all that. So I'm trying to get, so test item N95 surgical mask. Test case doesn't apply to the test object, not applicable. Test item doesn't meet a requirement. Pass.
Okay, now there's a really interesting thing that I can see on that. It says an N95 surgical mask.
Mm-hmm.
That is not the same thing as an N95 particulate respirator.
Mm-hmm.
So that's different.
Mm-hmm. I'm not claiming I'm an expert. I'm just trying to list
No,
show what I found. Mm-hmm.
I understand. Yeah.
So these are some of the tests that we're looking at. And then you go in and you see P pass and no pass, I think.
Right.
F for fail. We also check the dates, make sure the dates are accurate and when they were testing. And also when we look at the dates, it's important that that's the dates when they were manufactured. So that's another thing that we're looked at.
Right.
Okay. Again, so these are pass, they pass, and then some of the things are going to say they fail and I don't know, maybe if we're not available. But I guess my other thing was, if those masks will show you that they're 99 or between 95 to 99% pass, what could we do with them? Like if they're no longer on the list of like this list.
Well, you can hang on to them and use them for other non-aerosol producing procedures.
Or front desk, administrative, right?
Sure. Yeah, absolutely.
Okay.
You could.
But
not for they wouldn't be appropriate for use during aerosol producing procedures.
Okay. To me, it's just interesting. They were, let's just say if that manufacturer or that specific product was at 95 and above, they're no longer on the list. I don't want to get into it.
Well, and I think that the FDA responded, I believe, under a lot of pressure from the White House to open up the regulations in order to make things more available. And one of them was PPE, the other was test kits. And now that's all coming back to bite them because they allowed all these test kits to be approved under the emergency use authorization. And we're finding out they're not accurate. They're highly inaccurate. Some of them don't even work. Mm-hmm. And that's the same thing we're experiencing with these KN95s. They allowed them to be used as an alternative, but not necessarily the best. And the one that you sent me, if I'm scrolling down the page from the CDC, first of all, here's the stuff that the CDC says to look for in case to determine if your respirator is a counterfeit. Mm-hmm. No markings at all on the filtering face piece respirator. Okay, so there would be no markings on it. No approval or TC number on the respirator or headband. No NIOSH markings. NIOSH spelled incorrectly. That's how you spot spam, as things are.
Yeah, well, that's an easy one.
This one's my favorite. Presence of decorative fabric or other decorations or add-ons like sequins. That ought to be a dead giveaway.
Yeah. My favorite?
What's that?
When you see an FDA logo on the bag.
Oh yeah, they'll put the FDA logo. They'll put a NIOSH
on the box. Yeah. Mm-hmm.
Yeah. And then claims for approval for children. NIOSH doesn't approve of any respirators for kids. And the respirator has ear loops instead of headbands. So any N95 or KN95 that is truly a particulate respirator, not a surgical mask, is not approved because of the ear loop issue. And that's what this one is. So this is a surgical mask. It's not a respirator. Okay. And then if I keep scrolling down the page, there is a picture of this one with a line through it saying it's not NIOSH approved. So, I mean, it doesn't mean it's not a good mask. It just doesn't qualify as a respirator. So
I also think that KN95s were not intended to be NIOSH approved from the beginning.
No.
Only N95s.
Only N95s, because the KN95 is a designation from China, which is a different standard than what ours is.
Yeah, exactly. So it can't be an NIOSH approved KN95. It's just like
they're two separate universes. Yeah, absolutely. But some are saying that they are. Some of them have NIOSH printed on the little vent that's in the front, which is another thing I wanted to mention. If the respirators that you get, the N95s, for healthcare, should not have a vent on the front. They should not. And the reason is that they will filter out your exhalation. That's why they're there, to help you breathe easier out, to exhale, but they don't filter when you inhale. And that's exactly what we want, is that filtering when we inhale. So if they have the little plastic vent in the front or on the sides, then they're not appropriate to be used in dentistry.